In towns and cities across England, the NHS is at breaking point. We are fortunate to have one of the best health services in the world, but it is failing too many people for too much of the time. We could be anywhere in England. The problems described affect us all and require direct action by the politicians. If you've visited an emergency department recently, you won't be surprised to learn that the number of attendances has increased by almost 9% since 2005 to 2006. The number of patients waiting more than 4 hours to be admitted to hospital peaked at nearly 15% in November 2016. After a stay in hospital, your return home probably won't be straightforward. Delayed transfers of care rose by 41% in the last 6 years. This means you don't get back to your own home as soon as possible, and pressures on hospital beds have further increased. A visit to your GP surgery reveals a similar situation. Had difficulties getting an appointment? Well, a third of GP partners tell us that they are unable to fill vacancies, and a worrying 84% say their workload affects the level of patient care. The simple fact is that we have fewer doctors per person than other leading European economies. With only 2.8 physicians per 1,000 people, we lag behind Italy, Germany and France and are well below the OECD average. And this situation is only likely to get worse after Brexit, with 42% of NHS doctors who qualified in the European Economic Area considering leaving. A lot of this is to do with money. Hospital debts hit a record of £2.45 billion at the end of 2016, and by 2021, the NHS in England will have a mismatch of nearly £30 billion a year between resources and patient needs. The NHS is at breaking point, and this can't go on. Politicians must outline credible and sustainable plans that will safeguard the future of a fully funded and supported NHS. They must commit to help stabilise general practice in England, take action to improve the health of the population and reverse cuts to public health, address the pressures across the healthcare system that affect the delivery of high-quality, safe care, act to provide certainty to medical professionals and all NHS staff from EU countries, and commit to a long-term funding solution for the NHS. The NHS is at breaking point. We need to start mending it today.